Question 1. Mr. Thompson is a psychologist employed in a correctional facility and is tasked with conducting a psychological evaluation of an inmate accused of violent crimes. During the assessment, Mr. Thompson discovers that the inmate has a history of childhood trauma and exhibits symptoms of post-traumatic stress disorder (PSD). The inmate denies any current psychological issues and claims to be functioning well. Which of the following steps Mr. Thompson take in order to conduct a thorough and ethical psychological evaluation? A. Rely solely on the inmate's self-report since they deny any issues. B. Perform a diagnostic interview and administer standardized psychological assessments while maintaining neutrality and avoiding bias. C. Immediately diagnose the inmate with PSD based on the history of trauma. D. Conclude the evaluation early as the inmate does not appear to have significant psychological problems. Answer. B. Perform a diagnostic interview and administer standardized psychological assessments while maintaining neutrality and avoiding bias. Explanation. In this scenario, it is crucial for Mr. Thompson to conduct a thorough evaluation that includes a diagnostic interview and appropriate standardized assessments. Given that the inmate denies current psychological issues but has a history of trauma, it is important not to take self-reports face value, but to use standardized instruments to assess various psychological factors. According to ethical guidelines for psychological assessments, neutrality must be maintained throughout the evaluation, avoiding assumptions or biases about the inmate's psychological state. Making an immediate diagnosis, option C, based solely on historical trauma is premature and does not align with the principles of comprehensive psychological testing. Concluding the evaluation early, option D, is not appropriate unless there are clear reasons to terminate the assessment, which are not presented in this scenario. Option is incorrect because the inmate's denial should not be the sole basis for concluding no psychological issues are present. Question 2. Which of the following best describes the role of a psychological consultant when working in an educational setting, particularly when addressing issues like learning disabilities and behavioral interventions in schools? A. To make final decisions on special education placements without input from other stakeholders. B. To design and implement the school's curriculum based on psychological findings. C. To collaborate with teachers and parents, provide recommendations for individualized support, and assist in the development of behavior modification plans. D. To focus solely on conducting psychological assessments and leave all intervention strategies to teachers. Answer. C. To collaborate with teachers and parents, provide recommendations for individualized support, and assist in the development of behavior modification plans. Explanation. The role of a psychological consultant in educational settings involves working closely with teachers, parents, and other professionals to address learning disabilities and behavioral issues. A consultant's primary responsibility is to provide evidence-based recommendations and in designing individualized support plans, which may include behavior modification strategies. Option C. They do not make final decisions on special education placements independently. Option A. Such decisions are typically made by team, including educators, parents, and other professionals. Designing and implementing the curriculum. Option B. Is outside the consultant's role, as their focus is on supporting educational strategies. Creating the curriculum. Option D is incorrect because while assessments are important, the consultant's role extends beyond testing to providing intervention strategies, fostering collaboration with stakeholders. Question 3. Which of the following statements regarding the ethical considerations of psychological testing is most accurate? A. Informed consent is only required when the assessment results will be shared with third parties, such as insurance companies. B. The psychologist can disclose assessment results to family members without consent if the individual is a minor. C. Psychological assessments should be administered in a manner that ensures cultural sensitivity and awareness of diverse backgrounds. D. It is permissible to use outdated or unstandardized assessment tools if perceived to save time or money. Answer. C. Psychological assessments should be administered in a manner that ensures cultural sensitivity and awareness of diverse backgrounds. Explanation. Ethical guidelines emphasize the importance of cultural sensitivity when administering psychological assessments, as individuals from different cultural backgrounds may interpret or respond to tests differently. This ensures that results are valid and reliable across various populations. Option is incorrect because informed consent is required for all psychological assessments, not only when results are shared with third parties. Informed consent ensures that the individual understands the purpose, nature, and potential consequences of the assessment. Option B is misleading because while parental consent is often required for minors, disclosing results to family members without explicit consent from the individual may violate confidentiality standards unless there are overriding legal or ethical considerations. Option D is incorrect because ethical guidelines require the use of current, standardized, and validated assessment tools to ensure the accuracy and reliability of results. Question 4. Mr. Carter is a licensed psychologist working in a law enforcement agency to assess the mental health of officers exposed to high-stress environments. During his evaluation, he identifies that several officers have symptoms consistent with post-traumatic stress disorder (PTSD), including flashbacks and hypervigilance. However, these officers are hesitant to disclose the full extent of their symptoms due to concerns about stigma, potential impact on their careers. What ethical considerations should Mr. Carter prioritize in this situation? A. Encourage officers to disclose their symptoms fully, even if they may harm their career advancement. B. Prioritize confidentiality and ensure the officers understand the limits of confidentiality within the context of the law enforcement setting. C. Recommend immediate treatment and disclose the officer's symptoms to their supervisors without their consent to ensure safety. D. Allow the officers to determine the course of action based on their comfort, without any further involvement. Answer. B. Prioritize confidentiality and ensure the officers understand the limits of confidentiality within the context of the law enforcement setting. Explanation. In situations involving law enforcement officers, confidentiality is critical to maintain trust and encourage disclosure of symptoms, especially in high-stress environments. However, it is essential to inform the officers about the limits of confidentiality, particularly mandatory reporting requirements for certain risk behaviors, e.g., suicidal thoughts of violence. Option is problematic because while encouraging full disclosure is important, the psychologist must balance this with respect for the officer's autonomy and professional concerns. Option C violates the ethical principle of confidentiality, as disclosure to supervisors should only occur with explicit consent unless there is clear and immediate threat to safety. Option D is not advisable because the psychologist has duty to intervene and guide the officers appropriately, not just allow them to decide without professional input. Question 5. Which of the following describes the primary difference between neuropsychological assessments and cognitive assessments such as IQ tests? A. Neuropsychological assessments are focused solely on memory and learning, whereas cognitive assessments like IQ tests focus on personality traits. B. Neuropsychological assessments assess brain function and cognitive deficits resulting from injury or disease, while cognitive assessments focus on intellectual ability and academic achievement. C. Neuropsychological assessments require a more limited range of tests compared to assessments which use standardized testing exclusively. D. Neuropsychological assessments are used only for diagnosing intellectual disabilities, while cognitive assessments are used for a broad range of cognitive functions. Answer. B. Neuropsychological assessments assess brain function and cognitive deficits resulting from injury or disease, while cognitive assessments focus on intellectual ability and academic achievement. Explanation. Neuropsychological assessments focus on evaluating brain function and identifying cognitive deficits, particularly those caused by neurological issues such as brain injury, stroke, or neurodegenerative diseases. Assessments involve a broader range of tasks that evaluate specific cognitive functions like memory, attention, language, and executive function. On the other hand, cognitive assessments like IQ tests focus primarily on evaluating general intellectual ability and academic achievement, e.g., aptitude, reasoning, problem-solving skills. Option is incorrect because neuropsychological assessments do not focus solely on memory and learning, and IQ tests are not designed to assess personality traits. Option C is inaccurate as neuropsychological assessments generally involve a wider array of tests compared to IQ tests. Option D is incorrect because neuropsychological assessments are not limited to diagnosing intellectual disabilities, but are used to assess a wide range of cognitive issues. Question 6. In the context of psychological testing, what is the primary purpose of ensuring that a test has strong validity? A. To ensure that the test measures what it claims to measure and provides accurate results. B. To make the test accessible to as many people as possible by lowering the language complexity. C. To ensure the test is administered in a standardized manner across all candidates, regardless of conditions. D. To ensure that the test results can be replicated consistently, regardless of the test taker's condition. Answer A. To ensure that the test measures what it claims to measure and provides accurate results. Explanation. Test validity refers to the degree to which an assessment accurately measures the specific psychological construct it is intended to measure. For example, if an IQ test is being administered, it should measure intellectual functioning rather than unrelated factors like personality traits or social skills. Strong validity ensures that the test results are meaningful, reflect the concept being assessed. Option B addresses accessibility but does not directly relate to validity. Option C refers to standardization, which is essential for reliability but is distinct from validity. Option D describes the concept of test reliability, which focuses on consistency across different administrations rather than the accuracy of the measure itself. Question 7. Which of the following is the most significant ethical consideration when conducting psychological assessments with minors? A. The minor's ability to understand the purpose and potential consequences of the assessment with consent from the legal guardian. B. The psychologist's personal judgment about whether the minor is capable of benefiting from the assessment, regardless of guardian consent. C. The psychologist's duty to immediately intervene and report findings to the minor's school authorities, even without the guardian's consent. D. The psychologist's freedom to assess them without informing the minor of the purpose of the assessment, as it may cause unnecessary stress. Answer A. The minor's ability to understand the purpose and potential consequences of the assessment with consent from the legal guardian. Explanation. When conducting psychological assessments with minors, ethical guidelines emphasize the importance of both obtaining consent from the legal guardian and ensuring that the minor understands the purpose and potential consequences of the assessment. This is in line with the principles of informed consent and respect for autonomy. Option B is incorrect because the minor's understanding and consent are necessary, but the guardian's consent is also legally required. Option C is incorrect because the psychologist should maintain confidentiality and only report findings to school authorities if there is clear risk or with appropriate consent, not based solely on the results of the assessment. Option D is misleading, as transparency about the purpose of the assessment is necessary to avoid ethical concerns and ensure informed participation from the minor. Question 8. Which of the following is most relevant when addressing the ethical considerations of diagnosing and treating individuals with personality disorders? A. Diagnosing. A personality disorder requires the psychologist to use standardized assessment tools and avoid subjective judgments. B. Personality disorders should be diagnosed only if the individual exhibits symptoms that affect their ability to function in their personal and professional life. C. Treatment for personality disorders is unnecessary if the individual shows minimal impairment in their daily functioning. D. It is important. Recognize and address any potential biases or preconceptions that may influence the diagnostic process when working with individuals with personality disorders. Answer. D. It is important to recognize and address any potential biases or preconceptions that may influence the diagnostic process when working with individuals with personality disorders. Explanation. When diagnosing and treating individuals with personality disorders, it is crucial to remain objective and recognize the potential for bias or preconceived notions. Personality disorders can be complex and nuanced, and it is essential conduct thorough assessments that consider the full range of symptoms and functional impairment. Option is inaccurate because while standardized assessment tools are important, they should not entirely replace clinical judgment in diagnosing personality disorders. Option B is overly restrictive, as a personality disorder can be diagnosed even if the individual does not experience severe functional impairment, though the severity of impairment should be taken into account. Option C is misleading, as treatment for personality disorders can be beneficial regardless of the level of functional impairment, and that many individuals can benefit from interventions. Question 9. What is the primary consideration when conducting risk assessments related to suicide and violence in a forensic setting? A. The accuracy of the individual's self-report about suicidal or violent thoughts and behaviors. B. The individual's diagnosis of psychiatric disorder, which may influence their risk level. C. The environmental stresses and external factors that may influence the individual's current mental state and risk. D. The number of past suicide attempts or violent incidents the individual has experienced. Answer. C. The environmental stresses and external factors that may influence the individual's current mental state and risk. Explanation: risk assessments for suicide and violence require comprehensive understanding of both the individual's internal state and the external factors that may contribute to their risk. This includes environmental stresses, life events, social support, and ongoing situational pressures. Option is not sufficient by itself because relying solely on self-report can be problematic, especially in forensic settings where individuals may underreport or exaggerate symptoms. Option B may provide useful context, but diagnosis alone does not determine risk, as situational factors can play a significant role. Option D is factor to consider, but it is not the primary focus. Question 10. Dr. Simpson is conducting a psychological assessment on a client who is seeking custody of their children. The client has a history of substance abuse, but they have been sober for the past year. During the assessment, the client displays signs of anxiety and defensiveness when discussing past substance use. What should Dr. Simpson do in this situation? A. Avoid asking further questions about the client's substance abuse to prevent them from becoming upset. B. Discuss the client's substance abuse history in neutral, non-judgmental way to assess the potential impact on their parenting ability. C. Immediately refer the client to substance abuse rehabilitation program as their history suggests they may relapse. D. Encourage the client to ignore their past substance abuse and focus on the positive aspects of their current life. Answer: B. Discuss the client's substance abuse history in neutral, non-judgmental way to assess the potential impact on their parenting ability. Explanation: it is important for Dr. Simpson to address the client's substance abuse history as it may be relevant to the custody evaluation. Discussing it in neutral and non-judgmental manner ensures that the assessment remains objective and focused on the client's capacity to care for their children. Option is not appropriate because avoiding important topics can lead to an incomplete assessment. Option C is premature as the client has been sober for a year and referral to rehabilitation may not be necessary unless relapse is indicated. Option D could be seen as minimizing the issue, which would not provide an accurate or thorough evaluation. Question 11. In psychological testing, what is the primary purpose of including a control group when developing a new assessment tool? A. To compare the results of the test takers against a sample of individuals who do not have the condition being assessed. B. To measure the level of stress the test takers experience while completing the assessment. C. To identify how long it takes participants to complete the test and adjust accordingly. D. To create a separate group that is specifically trained in the use of the assessment tool. Answer A. To compare the results of the test takers against a sample of individuals who do not have the condition being assessed. Explanation: a control group is used to help establish baseline measures in the development of a new test, allowing for comparison against individuals who do not have the condition being assessed. This comparison ensures that the test is accurately measuring the intended construct and is not influenced by irrelevant factors. Option B, measuring stress, is not the primary purpose of a control group. Option C focuses on practical testing factors but does not relate to the purpose of a control group. Option D is incorrect, as the control group typically represents the general population or a comparison group, not individuals specifically trained in the assessment. Question 12. During a psychological evaluation for employment, the applicant discloses that they have been treated for depression in the past, but they are currently stable and not on medication. The evaluator notices a recent decrease in the applicant's job performance. What should the evaluator consider when interpreting this information? A. The applicant's history of depression should be disregarded, as they are currently stable. B. The decrease in job performance could be unrelated to the applicant's mental health history and should be investigated further. C. The evaluator should assume the applicant's depression is the primary cause of their job performance issues and recommend treatment. D. The evaluator should disclose the applicant's history of depression to their potential employer, as it may impact their job performance. Answer: B. The decrease in job performance could be unrelated to the applicant's mental health history and should be investigated further. Explanation: while the applicant's history of depression is important to consider, it is critical not to assume that the decrease in job performance is directly related to mental health without further investigation. Other factors, such as work-related stress, personal issues, or environmental changes, could also be contributing to the decline in performance. Option is not recommended because the history of depression may still be relevant, but it should not overshadow other potential causes. Option C is premature. The evaluator should not jump to conclusions about the cause of job performance issues. Option D is breach of confidentiality unless the applicant's mental health status directly impacts their ability to perform essential job functions, and even then, the applicant's consent would typically be required. Question 13. Which of the following statements best reflects an ethical challenge when conducting psychological assessments in forensic settings? A. The psychologist must always advocate for the interests of the person being assessed, even if their testimony may not be in the person's favor. B. The psychologist should avoid collecting information about a defendant's history of substance abuse as it is irrelevant to their legal case. C. The psychologist must balance the duty to provide objective assessments with the potential impact of their findings on the legal outcomes of the case. D. The psychologist prioritize the legal aspects of the case over psychological considerations to align with the court's interests. Answer. C. The psychologist must balance the duty to provide objective assessments with the potential impact of their findings on the legal outcomes of the case. Explanation. In forensic settings, psychologists face the ethical challenge of maintaining objectivity while acknowledging the potential consequences of their findings in legal proceedings. Their role is to provide accurate, unbiased assessments without allowing external pressures to influence their conclusions. Option is misleading because the psychologist's primary duty is to the truth and to providing an objective evaluation, not to advocating for the individual. Option B is incorrect because defendant's substance abuse history may be highly relevant, depending on the case. Option D overlooks the psychologist's duty to provide psychological expertise and does not prioritize objectivity, which is paramount. Question 14. When assessing children in a school setting, what is the primary consideration for the psychologist when selecting a psychological test? A. The psychologist should choose a test that is culturally appropriate and aligns with the child's linguistic and developmental needs. B. The psychologist should select the test that is most commonly used in school settings, regardless of the child's specific characteristics. C. The psychologist should focus on tests that are easiest to administer and interpret, regardless of the child's needs. D. The psychologist should select tests based on the child's age, ignoring other factors such as language, cultural background, and developmental level. Answer A. The psychologist should choose a test that is culturally appropriate and aligns with the child's linguistic and developmental needs. Explanation. When assessing children, it is crucial to select tests that are not only age appropriate but also culturally and linguistically suitable to avoid biases in the results. A child's developmental level, language skills, and cultural context must be considered to ensure that the test accurately reflects abilities and challenges. Option B is incorrect because commonly used tests may not be the best fit for all children. Option C is not ideal because the ease of administration should not outweigh the appropriateness of the test for the child's individual needs. Option D ignores the importance of considering cultural and linguistic factors, which can lead to inaccurate assessments if not taken into account. Question 15. Dr. Patel is conducting a psychological evaluation for a client who has recently experienced a significant life stressor. The client reports feeling overwhelmed and is unsure of their ability to cope. What would be the most appropriate initial step for Dr. Patel in this situation? A. Focus on the client's past coping mechanisms and encourage them to use those strategies to manage the current stress. B. Explore the client's support system and resources to help them build a plan for coping with the current stressor. C. Immediately recommend medication to address the client's feelings of overwhelm. D. Avoid discussing the stressor in detail to prevent the client from becoming too distressed during the evaluation. Answer. B. Explore the client's support system and resources to help them build a plan for coping with the current stressor. Explanation. The most appropriate initial step is to assess the client's support system and resources, as this can help Dr. Patel understand the client's current coping abilities and potential for improvement. By exploring these factors, Dr. Patel can help the client develop a personalized plan for managing their stress. Option A is less effective because focusing solely on past coping mechanisms may not fully address the current situation. Option C may be premature, as medication should not be the first recommendation without a comprehensive assessment. Option D is not advisable, as understanding the stressor is critical to providing appropriate support. Question 16. In forensic psychology, what is the most significant ethical concern when conducting an evaluation for a court case. A. The evaluator must avoid providing any opinions about the legal aspects of the case as they are not trained in law. B. The evaluator must maintain objectivity and impartiality, ensuring that their findings are based solely on the facts and not influenced by external pressures. C. The evaluator should consider the best interests of the defendant when making their assessment. D. The evaluator should ensure that their testimony is designed to help the team that hired them, even if it requires bias in their conclusions. Answer: B. The evaluator must maintain objectivity and impartiality, ensuring that their findings are based solely on the facts and not influenced by external pressures. Explanation: in forensic psychology, maintaining objectivity and impartiality is crucial to ensure that the evaluation is ethical and that the findings are based on facts, not influenced by external pressures or the legal team's interests. The evaluator's role is to provide an assessment of the individual, not to advocate for one side or the other. Option is not entirely correct because the evaluator may need to provide opinions related to psychological matters, but these opinions should remain separate from legal judgments. Option C, while important, should not override the need for impartiality and objectivity. Option D is unethical as it conflicts with the principle of objectivity and fairness in forensic evaluations. Question 17. Dr. Harris is conducting a psychological assessment of a child with suspected learning disabilities. The child appears anxious and reluctant to participate in certain tasks. How should Dr. Harris proceed with the assessment? A. Encourage the child to continue with the tasks by offering rewards to motivate them. B. Respect the child's reluctance and avoid asking them to complete tasks they find stressful. C. Continue with the assessment as planned even if the child is visibly distressed. D. Modify the assessment to accommodate the child's emotional state and anxiety, ensuring they feel safe and supported. Answer: D. Modify the assessment to accommodate the child's emotional state and anxiety, ensuring they feel safe and supported. Explanation: when working with children, especially those who may have learning disabilities or emotional difficulties, it is important to adapt the assessment process to minimize stress and anxiety. Dr. Harris should modify the assessment to ensure the child feels safe and supported, which may involve adjusting the pace, using techniques, or breaking tasks into smaller, manageable steps. Option: it may not be appropriate if the child is anxious, as rewards may not address the underlying emotional concerns. Option B, though considerate, may not allow Dr. Harris to gather the necessary information for an accurate diagnosis. Option C could exacerbate the child's anxiety, which could negatively impact the results. Question 18. In psychological research, what is the primary goal of using a double-blind procedure in an experiment? A. To reduce the possibility of participant bias by ensuring that participants are unaware of the study's purpose. B. To eliminate researcher bias by ensuring that the experimenters are unaware of which participants are receiving the treatment or control. C. To prevent participants from knowing the potential outcomes of the study which could influence their behavior. D. To ensure that participants can be compensated fairly without knowing the results of the experiment. Answer: B. To eliminate researcher bias by ensuring that the experimenters are unaware of which participants are receiving the treatment or control. Explanation: a double-blind procedure is designed to prevent both participant and researcher biases from influencing the results of an experiment. By ensuring that neither the participants nor the experimenters know who is receiving the treatment or the control, the procedure helps maintain objectivity and the validity of the findings. Option A describes the purpose of a single-blind procedure where only participants are unaware of the group assignment. Option C is not the primary goal of a double-blind procedure that can help prevent certain types of bias. Option D is not related to the purpose of double-blind experiments. Question 19. Dr. Lee is evaluating a patient who reports a significant history of trauma but is not currently experiencing any symptoms of ESD. How should Dr. Lee approach the evaluation? A. Focus solely on the trauma history as it is the most significant aspect of the patient's psychological profile. B. Assess the patient's current mental health and functioning to understand how the trauma may be impacting their present life. C. Conclude that the patient is not affected by the trauma and does not need further treatment. D. Ask the patient to relive the trauma in detail during the evaluation to better understand the emotional impact. Answer: B. Assess the patient's current mental health and functioning to understand how the trauma may be impacting their present life. Explanation: It is important for Dr. Lee to assess the patient's current mental health and functioning, even if the patient is not currently showing symptoms of ESD. Trauma can have ongoing effects that may not immediately manifest as diagnosable disorders. Understanding how the trauma affects the patient's present life is crucial in providing effective treatment. Option is too narrow and may overlook other important aspects of the patient's mental health. Option C is premature and could overlook underlying issues that may emerge later. Option D is not recommended as it may re-traumatize the patient without providing useful diagnostic information. Question 20. Dr. Martinez is conducting a therapy session with a client who is consistently late for appointments. The client has explained that they have a difficult time managing their time due to anxiety. Was the most appropriate response from Dr. Martinez? A. Ignore the lateness and continue with the session as usual. B. Confront the client about their lateness and emphasize the importance of punctuality. C. Collaborate with the client to develop strategies for managing time and addressing their anxiety. D. End the session immediately when the client arrives late to set a clear boundary about punctuality. Answer: C. Collaborate with the client to develop strategies for managing time and addressing their anxiety. Explanation: the most appropriate response is to work collaboratively with the client to address the root cause of the lateness, which in this case is anxiety. Dr. Martinez can help the client develop strategies to manage their time more effectively and address the underlying anxiety that contributes to their tardiness. Option A may overlook the client's challenges, while option B is confrontational and may not be helpful in resolving the issue. Option D is too extreme and may disrupt the therapeutic relationship unnecessarily. Question 21. Dr. Thompson is conducting a clinical assessment of a teenager who has been experiencing emotional distress due to school pressures. Which of the following would be the most important consideration when assessing the teenager? A. Focus primarily on the teenager's social interactions, as peer relationships are often the root cause of emotional distress. B. Consider the teenager's family dynamics and how they might contribute to or alleviate the emotional distress. C. Assess the teenager's past experiences with therapy to determine if they have had any prior positive or negative responses to treatment. D. Rely heavily on standardized assessment tools to ensure an measurement of the teenager's distress. Answer: B. Consider the teenager's family dynamics and how they might contribute to or alleviate the emotional distress. Explanation: family dynamics are often a significant factor in teenagers' emotional well-being. Understanding how family relationships and support systems contribute to the emotional distress can provide critical insights into the causes of the distress and inform treatment strategies. While peer relationships, option A, and past therapy experiences, option C, may also be important, family dynamics often have more direct impact on teenagers' emotional state. Option D is important for objective measurement but should be integrated with holistic understanding of the teen's situation. Question 22. A client presents with a history of chronic pain and is seeking psychological support to manage the emotional toll of their condition. What would be an important consideration for the therapist when designing a treatment plan for this client? A. Focus on providing only cognitive behavioral techniques, as they are the most effective for all psychological concerns. B. Consider the interplay between the client's physical health and emotional well-being, integrating both into the treatment plan. C. Encourage the client to minimize their focus on the pain to prevent emotional distress from worsening. D. Focus on long-term goals without addressing the client's immediate emotional needs related to chronic pain. Answer: B. Consider the interplay between the client's physical health and emotional well-being, integrating both into the treatment plan. Explanation: chronic pain can have significant psychological effects, and it is important for the therapist to consider both the physical and emotional aspects of the client's condition. Comprehensive treatment plan should integrate strategies for managing both the pain and the emotional distress that may result from it. Option is overly simplistic and does not take into account the complexity of chronic pain. Option C may overlook the importance of validating the client's emotional experience, while option D neglects the immediate emotional needs of the client. Question 23. Dr. Ellis is working with a client who has a history of substance use disorder. The client is currently sober but struggles with triggers that cause cravings. What intervention would be most beneficial for Dr. Ellis to use in this case? A. Encourage the client to avoid situations where they are likely to encounter triggers. B. Use motivational interviewing techniques to help the client explore their ambivalence about sobriety. C. Focus on addressing the client's past trauma to help them understand the root cause of their substance use. D. Suggest that the client attend a 12-step program as the primary treatment approach. Answer: B. Use motivational interviewing techniques to help the client explore their ambivalence about sobriety. Explanation: motivational interviewing is an effective intervention for clients with substance use disorders, especially when ambivalence about sobriety exists. Helps clients explore and resolve their own ambivalence toward change, empowering them to make decisions that align with their goals while avoiding triggers. Option A and past trauma. Option C are important. Is especially valuable in helping clients navigate the complex feelings they may have about their recovery. Option D can be helpful as a supplementary tool, but it should not be the only treatment approach. Question 24. Dr. Turner is conducting an intake assessment with a client who reports symptoms of depression but is hesitant to discuss their feelings. The client is also concerned about confidentiality. What should Dr. Turner do first to establish a therapeutic alliance? A. Reassure the client about confidentiality and provide clear information about the limits of confidentiality in a non-judgmental way. B. Focus immediately on the client's symptoms and try to push them to open up about their feelings. C. Avoid discussing confidentiality to prevent overwhelming the client with too much information at once. D. Ask the client about their past experiences with therapy to understand their concerns. Answer: A. Reassure the client about confidentiality and provide clear information about the limits of confidentiality in a non-judgmental way. Explanation: reassuring the client about confidentiality is crucial in establishing trust and making the client feel safe in sharing their feelings. Dr. Turner should provide clear information about confidentiality and its limits, ensuring the client understands the boundaries. Option B is premature, as it may pressure the client to open up before they are ready. Option C is not advisable, as transparency about confidentiality is key to the client's comfort. Option D could be helpful later in the assessment but is secondary to addressing confidentiality concerns initially. Question 25. Dr. Adams is conducting therapy with a client who has been diagnosed with generalized anxiety disorder, GAD. The client expresses difficulty in managing their anxiety in social situations. What intervention would be most helpful for this client? A. Encourage the client to avoid social situations to reduce anxiety. B. Teach the client relaxation techniques, such as deep breathing and progressive muscle relaxation. C. Suggest that the client confront their fears by engaging in social situations immediately without preparation. D. Focus solely on cognitive restructuring to challenge irrational thoughts about social interactions. Answer: B. Teach the client relaxation techniques, such as deep breathing and progressive muscle relaxation. Explanation: relaxation techniques, such as deep breathing and progressive muscle relaxation, are effective for managing anxiety, especially for clients with GAD. These techniques help the client reduce physical symptoms of anxiety and create a sense of calm. Option A would not be beneficial, as avoidance can reinforce anxiety. Option C could overwhelm the client and is not. A gradual or supportive approach. Option D is important but should be combined with relaxation techniques to address both the emotional and physical aspects of anxiety. Question 26. A client with post-traumatic stress disorder (PTSD) begins to experience flashbacks during therapy. What is the most appropriate response from Dr. Hayes in this situation? A. Allow the client to experience the flashback without intervention to avoid interrupting their process. B. Encourage the client to snap out of it by focusing on the present moment. C. Use grounding techniques to help the client reorient to the present and reduce the intensity of the flashback. D. Suggest that the client take break from therapy until they feel more comfortable. Answer: C. Use grounding techniques to help the client reorient to the present and reduce the intensity of the flashback. Explanation: grounding techniques are highly effective in helping clients with PTSD manage flashbacks. These techniques help the client reorient to the present moment and decrease the emotional intensity of the flashback. Option A could lead to the client feeling unsupported, while option B may minimize the severity of the experience and disrupt the therapeutic process. Option D is not necessary, as grounding techniques can be used within the therapy session to help the client regain control. Question 27. Dr. Nguyen is working with a couple who is experiencing communication difficulties in their relationship. The couple tends to engage in blaming behavior during conflicts, Which intervention would be most appropriate for Dr. Nguyen to use? A. Encourage each partner to write down their grievances to express their feelings in a less confrontational manner. B. Teach active listening skills and encourage the couple to reflect each other's statements without judgment. C. Suggest that the couple take break from each other and focus on individual therapy. D. Focus primarily on the partner who is most vocal during the sessions to ensure their concerns are addressed first. Answer: B. Teach active listening skills and encourage the couple to reflect each other's statements without judgment. Explanation: active listening and reflective statements are key tools in improving communication within relationships. By using these skills, each partner can feel heard and understood, which can reduce blaming behavior and foster empathy. Option may not directly address the root cause of communication issues, while options C could delay progress in relationship-focused therapy. Option D would be unfair and counterproductive, as both partners should be given equal attention. Question 20. Dr. Larson is working with a client who has experienced a recent traumatic event and is exhibiting symptoms of acute stress disorder. As weighs the best course of action for Dr. Larson in the early stages of treatment. A. Focus immediately on processing the trauma in detail to help the client understand the event fully. B. Encourage the client to avoid talking about the trauma until they are ready to discuss it in depth. C. Provide support and educate the client about the symptoms of AST, helping them understand their emotional response. D. Refer the client to a psychiatrist for medication management as the first step in treatment. Answer: C. Provide support and educate the client about the symptoms of AST, helping them understand their emotional response. Explanation: in the early stages of treatment for AST, it is crucial to provide support and educate the client about the symptoms they are experiencing. This helps normalize the client's reactions and allows them to feel understood and less isolated. Option may be overwhelming, as processing trauma too soon can increase distress. Option B could delay the necessary education and emotional support, while option D might not be the most immediate step unless the symptoms are severe and medication is needed for stabilization. Question 29. Dr. Oliver is working with a client who has been diagnosed with borderline personality disorder, BPD. The client has difficulty maintaining stable relationships and often experiences intense emotions. Which of the following approaches would be most effective in treating this client? A. Use dialectical behavior therapy (DBT) to help the client develop emotional regulation and interpersonal effectiveness skills. B. Encourage the client to avoid close relationships to prevent emotional distress. C. Focus solely on cognitive restructuring to challenge the client's distorted thinking patterns. D. Suggest that the client engage in group therapy to gain support from others with similar issues. Answer: A. Use dialectical behavior therapy (DBT) to help the client develop emotional regulation and interpersonal effectiveness skills. Explanation: Dialectical behavior therapy (DBT) is a highly effective treatment for clients with borderline personality disorder (BPD) as it focuses on emotional regulation, interpersonal effectiveness, distress tolerance, and mindfulness. Option B may reinforce avoidance behaviors, which are counterproductive in BPD treatment. Option C is important but should be integrated with DBT, which targets emotional and interpersonal challenges. Option D could be helpful as a supplemental approach, but DBT is the primary treatment for E. Question 30. A client with obsessive-compulsive disorder (OCD) is struggling with intrusive thoughts and compulsive behaviors. What is the most appropriate intervention for Dr. Graham to use in treating this client? A. Encourage the client to perform their compulsive rituals to reduce anxiety. B. Provide psychoeducation about OCD and introduce exposure and response prevention techniques. C. Focus on identifying and addressing past trauma as the root cause of the OCD symptoms. D. Suggest that the client avoid situations that trigger their intrusive thoughts to prevent distress. Answer: B. Provide psychoeducation about OCD and introduce exposure and response prevention techniques. Explanation: Exposure and response prevention is a highly effective treatment for OCD. It involves exposing the client to anxiety-provoking situations and preventing the compulsive response, which helps them learn to tolerate anxiety without resorting to rituals. Psychoeducation helps the client understand their symptoms and the rationale behind option O would reinforce the compulsive behaviors, while option C may not be relevant to the client's current symptoms. Option D could contribute to avoidance, which can maintain and exacerbate OCD.